Thank you for taking time to share with us today.
Thank you for the opportunity, and to everyone who's tuning in and sharing their questions. We all know this is a wild world we're living in, and we're going to keep trying to stick together. So I'm speaking to you right now from Athens County in southeastern Ohio. I have for 15 years operated a small private childcare center serving less than 50 children a year with a mix of PFCC and private pay families. I'm close to Ohio University and to Hawking College, and so I have a mix of kids and families from a variety of backgrounds. Currently, my building is sitting empty, and I have 2.5 gorgeous acres where the grass is growing tall. I personally am in a decision tree framework of my own. So this tool that I'm going to share with you is born of my very own decision-making process. As a board member on OACCP, I speak most loudly for the Appalachian region in general, which is 30 counties in most of the eastern half of the state, but also for small providers, because I feel like I'm kind of on the borderline between being a family provider and a center, although of course I adhere to center rules. I really operate as a family kind of business. And so I think it's important to all of us to keep in mind that none of us is alone in this, and the way these rules impact us may sound a little bit different or look a little different, or there might be some more zeros at the end of your bottom line, or less zeros in some cases, like my own. But truly, I think the most important thing is for us to all be talking together and to be talking to Kara, who, bless her, is a wonderful listener and actually will hear us when we ask for help. Nobody can give everybody everything they want, but I think the more we communicate, the better our chances. So if you want to flip ahead and check out this decision tree tool that I've made, for those of you looking at this from your phone or from a small screen, I'm sorry, the print's small even on a big screen, but I think this presentation will be made available, and so if it's something you want to look at more closely, you'll have that opportunity. So basically, we now have some guidance on when childcare will be permitted to get back to being the workforce behind the workforce, and we're all probably hesitantly excited about that. And this tool is just probably not new information for anyone, but hopefully a way of organizing their thinking that can help sort of guide decision making. And as I say, I'm using this for my own decision making process. So you start here. The first thing is that you've been maintaining regular communications with your families, no doubt. And so, of course, the first step in the decision process is to just ask them, how many do you think are going to return? I would offer a particular date if possible, and be sure to make clear that this is not a plan or a promise, because a lot of people are anxious to come back to childcare, and everyone is hungry for concrete and finite information, but I would urge everyone to not offer that unless you're sure you can return, and keep good on your promises. So open-ended questions like, if we were to open on X date, would you be back? Would you be part-time? Would you be full-time? Has your employment changed? Did you once operate as a private pay family, but now you qualify for subsidy? These kind of questions. And also thinking about age mixes. As we know, these group sizes and ratios change our operations substantially. There were ways of making things work prior with different age groups that have changed, even uses of space that have maybe changed. So basically, the very first bottom line decision is, do more than 25% of your families intend to return to childcare? If yes, then we can go on down the tree. If no, then it's probably worth considering closure or further delay. I can tell you in my own circumstance, I'm on the further delay end of the spectrum, as I don't yet have confirmation from 25% of families that they will return to our center. But when I get to that point, then I'll go back to the question of opening the center at reduced capacity. In my case, as a small building, I know that I can't do much with the capacity that I have because I have such a small space. Dividing rooms is not an option for me. For many of our larger providers, it is. Again, for family providers, this is another place where I empathize and can say we're kind of stuck with the space that we have. And so therefore, we're also stuck with the capacity to serve that we have. And so do we have enough workforce? Do we have enough PPE and sanitation material? Do we have sufficient reserve cash? And here, again, I'll underline what that we are fortunate to be in an industry that did get a little extra support. So in terms of getting the grants that we know Kara told us are going to be coming soon, and also the closure payments for those that served PFCC children, we've been blessed in some ways to have some sustainability. So basically, we're at a decision point of, do we open at reduced capacity? If no, again, we're going to be in the closure process, and OACCP is working on some resources there to help people sort of wind down their operation, as sad as that may be. It's going to be happening. We know it's going to be happening more than we want it to, and we're trying to provide support there as well. Stay tuned for that. Assuming we do want to open at reduced capacity, as we all know, we understand that the temporary pandemic license will end on May 31st, and at that point our closure payments will also cease. As Kara just said, this is news to me as well. Those will actually be ending a week early, which is another factor to consider in your operation and your ability to open. So we'll kind of pass through the pandemic licensure and assume that we're still on, yes, we're going to open at reduced capacity. And are we going to open on a temporary basis? This is a huge challenge for everybody, but it might be worth considering to kind of check out how it's going to work, and also to be aware that although we hope the number of cases continues its decline, it may not. And as Kara mentioned, at the center where one person was infecting or at least interacting with 70 people, and then we have this giant spread and we have to close down again. There's a lot to consider even when we do get to the point of wanting to reopen. Even if we can say we can make it at reduced capacity, still there are decisions and questions to think about there. So finally, if we decide that no, we aren't going to operate on a temporary basis at reduced capacity, maybe we try to find a way to increase capacity with some building modifications. As I said, for me, that would be adding a room to a building, which is unlikely to be something I can afford, but for those larger providers or that have a different arrangement of space, room dividers are a possibility. And so then hopefully we get to the point of, yes, we're going to resume operations with the necessary PPE and health safety modifications. And here's some final considerations there. You know, we are going to try to budget for what we expect with Step Up in September. We're thankful that Step Up will continue, but we want to know what does that look like for our bottom line between now and September and thereafter in terms of making sure we're still meeting the guidelines and hopefully continuing to improve our quality. And I think I would like to say that no matter where you end up stopping or continuing through on this decision tree, the big question is, how will you advocate? So throughout the decision process, remember that your voice does need to be heard. Use the social media channels, direct communications with elected officials and regional representatives of whatever sort to ensure that your story is a part of the restructuring of our industry. You have your first opportunity with the JFS survey that Kara mentioned, and I know a link will be coming if you haven't already received it. So consider carefully what your priorities are and how together we can speak with a stronger voice for the issues that are universally impactful, as well as how we can speak specifically for our own business, region, and comrades. And I really wish you all the best of luck. Thank you for your time.
Megan, thank you very, very much for taking time to share that with us. We appreciate your willingness to share the tool, and we will make it available to people. I see a lot of questions in the chat room about whether or not this will be available, and Megan has graciously shared it with us. Also encourage you, if you are not a member of OACCP yet, to sign up. Now is a good time to join, and you will have access to other members only benefits through the Ohio Association of Child Care Providers. I also want to clarify just on the payments, the last week of the weekly closure payment would be week ending May 30th. So the weekly closure payment would stop that Saturday, and then starting Sunday, May 31st is when we would go back to regular publicly funded childcare payments based on your star rating as of March 26th and based on the attendance, not on enrollment. So just clarifying that. And you cannot continue to expect a closure payment, and you cannot continue to bill the state for a pandemic day just because you decide not to reopen. The only reason you would use the pandemic day is if you reopen and then have a positive COVID or an expected COVID case and have to close. That's when the pandemic days will be in play going forward. So Karen, if you have anything else you want to add to that, I just see a lot of questions about that and wanted to make sure that's as clear as we know with the information we've been given from JFS at this point. So Megan, again, thank you for your willingness to share. And then Next up, we have Linnea, who, just like Megan was talking about, the need to engage the community. We also have opportunities because we know with these reduced group sizes, it puts tremendous financial strain on childcare providers. And so we want to make sure we engage your voices in educating decision makers on what is needed from the field. Linnea.
Perfect. Thank you. And thanks, Megan, for such a great segue. I'm Linnea Gutierrez. I'm the Policy Director and Legal Counsel for Groundwork Ohio, and we are the statewide early childhood advocacy organization that is committed to advancing early learning and healthy development strategies for young children and families during the prenatal to 5 period of life. So childcare has certainly always been at the top of our priorities, but is among a number of different interventions that we advance and monitor across the state. So first, I just want to echo the other panelists in thanking you for all the work that you do. My family is one of the many that will be returning to your programs on June 1st, and I have a really deep appreciation, I think, as a parent and in my early childhood systems work at Groundwork, listening to all of you and learning from you the incredible responsibility you have in caring for your children and making the decisions, you know, from here until May 31st upon reopening. So please know we are doing our best to support your program staff and the families and children you serve. If you have not been engaging with Groundwork Ohio before the pandemic or over the past couple of months, I want to invite you to please sign up for our newsletter at www.groundworkohio.org. We will provide you or continue to provide you with the most up-to-date information you need to know that we have available and support you in being your own best advocate. So if you've never viewed yourself as engaging in advocacy before, take today as an open invitation to join us. The reality is that all of you will need to be your own best advocate for yourself, your business, your staff, your families, and the children you serve. And advocacy is Groundwork's full-time job, so let us help you engage in informing policymakers about your needs and priorities during the pandemic. We're doing our best every day to create easy and accessible opportunities for you to do that, to lend your voice to support policies that serve the child care system in Ohio. So while you do your full-time job caring for children, please consider taking a few minutes a week to engage with us in this collective work. I'm going to make a couple kind of announcements and updates in terms of getting you up to speed on both state and federal advocacy. So at the state level, we've been engaging with the state of Ohio, both the administration and the Ohio legislature, to educate them on the needs of the child care system, especially during the pandemic, and protecting, preserving, and increasing funding in the system. Keep in mind that the state is preparing for decreased revenue. We've already seen the incredible economic impact of COVID-19 on our state. And that means that all programs serving children and families, including the child care system, which really needs more funding than ever to support operations during COVID-19, will continue to face ongoing threats. So we should all view this as a marathon and not a sprint, and we are navigating how we protect funding in our system at every turn as we continue our work this summer, the fall, and into the next year. So right now, this week, we have 2 active opportunities for you to engage with state policymakers in this work. The first is that we are collecting stories about the impact of high-quality childcare. We know that we can do our work and be best advocates every day, but if we are not sharing the stories of your programs, your staff, your children and families, that we will really never reach our policymakers in a meaningful way. You are their constituents, and your stories are second to none when it comes to influencing policy. So we are collecting stories about the impact of high quality childcare, and we intend to take these collection of stories and share them with your state policymakers. So the format for this is available on our website. You'll see the link in the chat box, and you'll get that later today as well. It requires you to submit answers to just 2 questions about the work you do. So we appreciate doing that and welcome you to share your contact information so we can follow up with you to make some more direct connections with state policymakers as we learn more and more from the responses we get. The second opportunity to engage in state advocacy this week that we are happy to share with you is that this Friday we've been asked to lead a child care panel before the Ohio Legislative Children's Caucus. This panel will be at 3 p.m. on Friday. And the Ohio Legislative Children's Caucus is a number of legislators, both from the Ohio Senate and the Ohio House, who are committed and interested to children's issues. And childcare has been among one of the topics that has come up frequently in the past year, even before the pandemic, and they are very anxious to know about how they can support the childcare system. So we are creating a panel to help them learn and answer questions, and I would encourage you to all listen in about how your policymakers are filtering this information and where they stand in terms of funding our childcare system from the state level. So please listen in and provide feedback to us during the webinar so the policymakers can see the feedback that you are getting, and we will share that with them to the extent we can during the panel, but also as a follow-up after the panel is complete. The second piece I want to share is our federal advocacy. So our federal advocacy, engaging with Ohio's federal delegation in Congress, is critically important now more than ever. As the panelists mentioned, just as an example, there's an anticipated grant program yet to be announced from the state of Ohio to support childcare. And that grant program is utilizing the remaining CARES Act dollars that were put into one of the federal stimulus packages to support childcare across the nation. And so this grant program is being created to help support your new costs of operating, which Kara from the Department of Job and Family Services again mentioned. I just want to share with you that total amount that was given to all the states in the CARES Act was $3.5 billion. And approximately $117 million came to the state of Ohio. And you need to understand that this money, now an estimated $60 million total remaining to spend in the state of Ohio, while sounds like a lot of money, will only be able to support a grant program for the next couple of months. And given that our state doesn't have new revenue coming in, they are limited in their ability to maintain this grant opportunity and the current funding of the system. So that means we need the federal government and Congress to deliver on further recovery dollars for childcare. Over the past couple of weeks, Groundwork has been supporting a national ask for $50 billion new dollars to support childcare across all of the states. And on Friday, the United States House of Representatives passed the HEROES Act, which unfortunately did not include the $50 billion ask. It did include $7 billion for childcare across the nation. And while this is appreciated, this is a far cry from the full needs of our system. Now, as the HEROES Act will go forward, it goes to the United States Senate for deliberation. We are again trying to influence the Senate to increase that amount to $50 billion. This amount is necessary because we know nationally they're estimating that it costs $9.6 billion each month to sustain childcare across the United States. So, how can you engage this week with federal policymakers to support this critical ask? So first, we need you to tell Ohio Senators Portman and Brown that we need $50 billion to support childcare. And we have created a very easy way that you can do that this week on Twitter. So you'll see from week to week that we'll have different opportunities for you to engage in. This week is directed to Senators Brown and Portman, and it is through Twitter. You'll see the link in the chat box to engage in that Twitter campaign to make sure the senators know why this is so important. And I will also then share with you, secondly, that stay tuned for an additional opportunity to engage and listen to a member of the Ohio congressional delegation alongside a state member of the Ohio legislature to see where they stand in terms of childcare. So we will continue to share these announcements and reminders both on our website and through our newsletter. So thank you for your work. Thank you for your advocacy. If you haven't engaged with us, thank you for considering that. And again, we'll do our best to make it as easy and accessible for you as possible, recognizing that the most important work you do during the day is for our youngest children. So please lean on us to support you, and remember that all the reminders and materials referenced or shared during this webinar will be shared with you later today and available on our website at www.groundworkohio.org. Thanks so much.
Thank you, Lynn-Ann. I appreciate that. And I know I see some comments in the chat room about wondering if any of this really makes a difference. And I just want to assure you that it does, and that our federal lawmakers, they literally have staff people that count how many inquiries and requests come in for various topics. And so sending larger quantities of people saying, hey, childcare is important, we need increased investment, it is super critical right now. And I know sometimes when you send off that email or fill out a form, you don't know if it's really making a difference and if anyone is even listening or paying attention. But I tell you that they are, and we really need your voice and your parents' voices, your staff's voices contributing to this to increase the amount that we're getting from the federal level, because that's the only way the state can continue to provide support here in Ohio to childcare providers across the state. So please, please, please take advantage of these opportunities. Groundwork has made it really, really easy. It takes less than a minute to fill out the forms and to do the things they're asking. So please sign up and be part of that process. So Karen, I'm wondering if, I don't know if you can come back on for a minute. I see a lot of questions in the chat room. I want to assure you that family childcare providers, we hear you, we see you, we know you're asking for clarity, and we know you're frustrated because when these announcements come out, it's not always very explicit about what applies to family childcare and what doesn't. We continue to ask for that clarity when we talk with Kara and Leanne in other settings. And I know that in those emergency rules that Kara just talked about coming out, there will be much more detail that apply to family childcare as well. I also see a lot of questions about the divider walls and the portable sinks. And I know people are making tough decisions about, is it even wise to try to split up my room? Do I have enough space? And I want to make sure everybody has seen this responsible restart. This got emailed out, and it has, on the left side, it has mandatory things that childcare must do. And on the right side, it has recommendations. And so I think this is, this is what we have right now. Obviously more detail is coming, but I encourage you to read that, and it explains more about the divider walls. But Karen, can you shed any light on the divider wall debate?
I wish I had more detail on the divider walls that I could share. I'm Karen Lampe, and I'm the advocacy chair for the Ohio Association of Child Care Providers. And along with the other presenters, we've been working to try and get answers to a lot of these questions. First, I just want to share with folks, we had over 1,500 individuals that have been on the webinar today. And lots of you are asking questions, which is wonderful. And we will work to try and get answers to those. Unfortunately, we won't be able to answer everybody's questions today, but we're going to try and cover, as Robin said, as many of them as we can. The good news is I think many of the questions that have been asked in the chat, Robin, will be covered in the best practices webinar that will be coming out from JFS in the coming days, as well as in the emergency rules that are coming out. So I know in conversations that we've had with Kara, there will be more information specifically about the dividers in the coming days. I would encourage you in the meantime to talk to your fire department as you think about dividing up your spaces. They will be probably the most important group that you work with locally to do that, even if they're just temporary temporary dividers. They will want to make sure that you still have clear access to exits, et cetera, during that time. You also need to make sure you still have the 35 square feet on whichever space that you divide out. You'll still need the 35 square feet per child within that space. So it's important to really think about how you do that. Portable sinks, I saw quite a few questions about portable sinks. This is one of the pieces that we did advocate for, and they said yes, that they would allow us to finally use portable sinks. They've been used in other states for years, but we had never been allowed to use them in Ohio until now. OACCP has been working with a organization that I believe they're the leading organization that sells portable sinks in early childhood communities, and was able to get a discount for OACCP members. So if you're an OACCP member, I would encourage you to go to the website, and under the members section, there's information on how to get that discount. The other thing that I saw a lot in the feedback that we were getting in the chat was information about, or questions about, how do I talk to my families about this? Are there letters about that? And I would encourage individuals to sign up for the Early Learning Resources Ohio. There is a lot of information on there, as well as sample letters. In addition to that, Child Care Aware recently came out with some sample letters that are available as well. So again, those are two good resources to look for some of those sample documents to be able to utilize in communicating with your parents, and having policy changes, et cetera, that are samples that you can look at. Robin, so what are some of the other questions that you see that maybe we can answer?
I feel like we need to clarify again about how the PFCC regular payments start again. Some people are asking about, do I use the TAP system again, May 31st? You want to cover that one?
I sure will. And Julie, I see you just posted the link for the Early Learning Resources Ohio. Thank you for adding that. That's helpful. It's really inexpensive to join. Again, if you're an OACCP member, there's you can get a discount to join as well. So the question, again, Robin, was about rates. So the closure payments will end come that last week before we restart. We restart on the 31st. Again, you don't have to reopen your building on the 31st, or on the 1st, either way. But if you're going to, and you have publicly funded children, they will, again, need to start utilizing the TAP system to track attendance, because our reimbursement or our reimbursement rates funding will go back to being done based upon attendance like it was pre-closure. Some suggestions for individuals that asked, I saw this question earlier in the chat. Some ideas is to use the QR code that you can use with TAP, and then parents can scan that with their phones. The other thing is you can take the actual TAP tablet out into your parking lot and have them tap in out there. One suggestion would be to cover your tablet with a plastic bag of some sort. It will still work in order for them to tap in. But that way, when you're cleaning that plastic bag, it's not deteriorating the glass that's on the front of your tablet. So just a thought. Great.
And just to clarify, the weekly closure payment stops May 30th. And if you do not want to reopen, you cannot continue to get a weekly closure payment, and you will not get any other type. You cannot bill pandemic days if you have not reopened.
Correct.
Just want to make sure that's clear, because I still see some questions about that.
Right.
The other big question I think that providers are struggling with is how to make the tough decision about which families to accept back in if you do have more families than you have capacity to take because of the reduced group sizes. So I think this is one that each provider has to make their own decisions and figure out how to communicate that to families, and these letters you talked about might help. But do you have any general thoughts about questions maybe that they could pose or ways to think about that?
So I think each of us individually are going to have to think about what is the priorities of our organizations. Some of us have organizations that are affiliated with companies, and therefore they might prioritize individuals that work for that company before they prioritize people from the public coming into the building. Others have missions that are specific to serve certain groups of children, and obviously they might prioritize those children before other children that would be coming into the program. There are other programs that will have to make those priorities based upon financial. And so therefore, if it's more financially applicable for them to bring in preschool kids or toddlers over school agers, they may have to make that decision just out of sheer necessity in order to survive. So those would be the things I would really think about. What is the mission of your program? What are the affiliations of your program? And also, what is the space that you have available that best suits the children that you're bringing back in? Another thing to think about is also how long will we be at these lower ratios and group sizes? And unfortunately, that's not an answer we have at this point. And it's not an answer that I think that anybody can get to, as we don't know how long COVID will continue to be a threat in our communities. We can do the best we can to minimize the risk of spread within our programs. We cannot alleviate or get to a zero risk within our programs. So this is one of the ways that we can minimize the risk, is by having these smaller ratios and group sizes. Obviously, it's a financial struggle for providers. Hopefully the grant information will be out soon and can help us all as we make decisions from a financial standpoint about what's realistic for us. But I think all of that's going to come into play when we have to make decisions about which families that we bring back to our programs and which ones that we don't. I would encourage you to, if you are turning families away from your programs, to try and capture somehow the stories. I think it's going to be important from an advocacy perspective to have those stories to be able to share with legislators and the governor's office and other advocates around the challenges that families are having in finding safe, licensed childcare. So, you know, OACCP is working on a way to try and organize those and centralize those messages. But in the meantime, if you're talking with families, make sure that you're collecting those messages as well.
Yeah, I think that's really important I would encourage you all to figure out who your local representatives and senators are and make sure you encourage parents to share stories if there isn't space at a child care provider for them, because they do need to hear about that. I also want to reference there are some questions about, should we consider a release that includes COVID-19 for our families? And we do have one that has been drafted by an attorney that we work with in the Dayton area. Obviously, we're not providing legal counsel or advice to any individual organization, but we do have the release that is available. We will email it out to everybody. If you would like to use it or modify it in some way, it's there and available. It does have a lot of legalese language that isn't super customer friendly, but it does have the pandemic language in there if you feel like you would like to add that to your release. So that's another question that some people were asking. All right, I think that's, I know we're over time. I know that we couldn't answer all the bazillion questions that you all have, and we are eager to get those answers as well. We will continue to work with Kara and Leanne, and we'll serve up the questions that you put today in a consolidated manner so they can get back to them. We do know it's hard for you to make decisions without the information about the grant and without all the rules, and we know they're working to get it out to you as quickly as possible. So thank you for all you're doing, and we will continue to share information as it becomes available. Thank you, everybody.
Thank you, Robin. Thank you, Lynn Ann and Megan.
Thanks, everyone.
Thank
Good
you.
luck.
Bye-bye.